So I thought you had a bit too much medicine already in 2 days, so we'll talk a little bit about art. Anybody knows what this is? Dali. What you know the name of this? No? Well, we'll take a look at it later. This is a little bit about me. I'm a graduate of U of M, both undergrad in chemistry and U of M Medical School. And I'm a board-certified internist, and I'm a founding member and registrar of the Minnesota Homeopathic Association. And all the information that I'm going to be talking about is in this booklet, which you can find on this website, bookonhealing.com, and you can read it right off the site. Or you can buy it, if you call the office, they'll send it to you. A little bit about history. I'm a collector, and I collect postcards with homeopathic hospitals on them. This is one of them. eBay is great. So I'll show you a few. This stuff used to be very popular in this country. As you can see, big hospital. So how did I get into this in the first place? Well, I was a med student at the U of M Medical School, and we had this group called Humanistic Health Committee, and we would invite all kinds of weird people to talk to us, so at least we'd know what's out there in the community. And one of the people that came was Tom Stoll, who was a naturopath in St. Paul, Wellspring Naturopathic Clinic. He told us about homeopathy. I thought this was the weirdest of them all. It didn't make any sense to me. Nonetheless, the guy didn't look like he was strange, so something didn't fit. So I decided to look into it a little bit more. I was in the second year of med school at the time. This was about 85. So he gave us a little talk, or a class, like a few session class on acute prescribing. So I got me a bunch of remedies. I took the class, and I started looking for a suitable patient to try this on. And this was my first patient. This is my grandmother, who, as all Russian women, likes valerian. As you may know, I don't know if you see a lot of Russian patients, but they always smell of valerian. Anyway, when we came here, this was 82, 84, 85 or something. I didn't know where to get valerian for her. So this one day, she has an anxiety attack, so I tell her, "Look, Grandma, I found valerian for you." I actually lied. What I gave her was aconite, which is a homeopathic remedy that's sometimes useful in anxiety. And so it so happened that I lucked out, and it worked on her real well, and she was better within a couple of minutes. And I thought, right, placebo works real well. So next time this happened, I gave her placebo. And since I made them myself, it tasted, they looked exactly the same like the first one, and it did not do any good. So about an hour of waiting, no change. We gave another dose of aconite, works like magic again, just like this, she just melts. So that was my first introduction to practice. I was pretty impressed. There's another hospital. This is University Hospital, University of Michigan. Second case, this is my father, actually. I'm at this point in the fourth year of med school, and Dad gets this strange illness where he loses about 20 pounds of weight. He has a SED rate of about 130, which is quite high, as you know. Sweating, body aches, he hurts all over. So they admit him at Mount Sinai here, do a workup, find essentially nothing except a high SED rate, and tell Mom that he needs to be started on steroids. Diagnosis, polymyalgia rheumatica, maybe temporal arteritis, whatever, some autoimmune disease. So I, by then, know a little bit more about steroids. I thought, well, let's try something else. So at this point, he's in the hospital. He's bedridden, can't get up even to go to the bathroom. So Mom goes to this homeopath I told her to go to. He gives her a little thing. She takes it to him in the hospital, gives it to him at night. In the morning, he gets up. The pain is gone. Okay, So docs say, okay, well, he's better, let's discharge him. And over the next month or so, he was cured by the homeopath with no steroids. Everything was fine. The SID rate came down to 10. And he's been fine since then. This is already, 20 years. So this really brought it in perspective for me. I was studying conventional medicine, and yet I saw that this stuff is much more powerful, and I couldn't possibly get this kind of response from a conventional drug. And of course, steroids, you talk about side effects like osteoporosis, diabetes, etc. You don't want to do this if possible. So I decided to go study homeopathy. So after I finished my internal medicine residency, which I did in Chicago, I took my boards, passed that, and then went to England. I studied there for 6 months at the Royal London Homeopathic Hospital. And then I thought that wasn't enough, so I went to India for 6 months and studied there with some good homeopaths. And then I came back here and started my practice in '92. This is Dr. Hahnemann, the founder of homeopathy. This is the only monument to a physician in Washington, D.C. This was dedicated by a president in 1900, so you can see this was very popular. So a little bit about Dr. Hahnemann. He was a German physician, and he finished his med school in Germany somewhere around 1795 or so, and went to practice medicine like he was taught. And the teaching at the time was the main things were mercury and arsenic, of course, and of course bloodletting. And so he practiced like that for a while, and he saw that he wasn't doing most of his patients a big favor. And because he didn't know any better, he quit medicine altogether and went into translating and chemistry to make a living. He was a very accomplished chemist, but it is through his translations that we know how he came up on the idea of homeopathy. And when he was doing translations, often what would happen is he'd add notes into the translation, contradicting the author, and didn't make too many friends that way. But it is through one of those that we know about homeopathy. So this is what happened. He is translating this book by Cullen, an English physician, about malaria. And the doc says, well, malaria is cured by quinine because it's so bitter, this quinine, that it kicks something out of the body by just the fact of its bitterness. So Hahnemann then writes, no, I don't think that's the reason that quinine cures malaria. And that, in fact, he took a large dose of cinchona bark from which quinine is made, which is really pretty bitter, and basically developed a poisoning to this cinchona bark, which looked remarkably similar to malaria symptoms. So he had the rigors, the diarrhea, and whatever else was coming along with that. So he then writes, maybe it cures malaria because it causes similar symptoms in healthy people. Okay, we got a hypothesis, we need to test it. So at this point, whoever is not afraid to visit his house, he gives them something to take. So they get sick, and then he notes down the symptoms. And he called these experiments provings. So he would decide, okay, today we're going to be proving this substance. So everybody's taking this substance in whatever form, and then he writes down all the data on that, and they keep on doing this with his students. And after a while, they developed quite a big body of data on a whole bunch of different substances. And then he started seeing patients and treating them with these things. So whenever he would see somebody whose symptoms, as they presented, resembled symptoms of poisoning by a particular substance, he would give them that substance to take. And a lot of people got a lot better. So that's all homeopathy is. He actually coined the term homeopathy, coming from two Greek roots, homeos for similar, pathos for disease. So all it means is similar disease. Similia similibus curantur is a Latin phrase you see in all these homeopathic books. It means let legs be cured by legs. So this is the only principle.